Hello. Our group will be presenting about the Gatorwell HIV testing evaluation. This group includes Kellen Kaser, Kaya Kirsch, and Karina Stepp. The mission of Gatorwell is to empower UF students to be healthy and well through prevention. Regular HIV testing is a proven prevention tool for lowering HIV infection rates in communities. This program was created to supplement the existing HIV testing available to the University of Florida community. Prior to the program's inception, HIV testing in the form of a blood test could be obtained at the Student Health Care Center. With the introduction of this program, people can obtain testing in the form of an oral swab in a community-based setting. The individuals and organizations serving as stakeholders include the university faculty and staff, Gatorwell staff, the Alachua County Health Department, Alachua County officials, and UF students who access the services. The program meets the criteria for being able to be evaluated with the following. The program could be described as in the maintenance stage. The intervention is based on the health belief model and works according to those principles. We can use existing data in combination with gathering additional data from participants and a control group. Finally, stakeholders are committed and enthusiastic. Based on stakeholder meetings, it was determined that the primary aim of the program is to incorporate the health belief model concepts into the post-test session. In other words, students are expected to review healthy sex practices and issues related to one's perceptions and beliefs related to their susceptibility to HIV, how severe one perceives one's risk of contracting the virus, benefits, threats, and barriers to safe sex practices, and explore what might cue action to practice safe sex and one's sense of self-efficacy. As this is the primary goal of the program, guided by the health belief model, assessment and evaluation should focus on the concepts described above. Evaluation should also serve to clarify who uses the program, what barriers might exist for those who don't, and how to increase reach, along with providing important information about what distinguishes it from other available services. Intervention occurs during a 20-minute initial appointment and after the student has been tested in a 15-minute session. Program staff intervene with a risk assessment and post-test survey, followed by a results review in the second appointment. The post-test survey focuses on the primary goal, along with the secondary goal of evaluating the testing experience and impact and expanding the reach of the program. We propose to use a quasi-experimental approach in our evaluation design. An updated evaluation design to assess both the primary and secondary goals will include participating students and a control group of non-participating students. Our recommendation is to modify and incentivize the current post-session evaluation for participating clients. In addition, we propose creating a parallel survey to be offered to a sample group of UFL students who have not accessed HIV testing in the past. This will allow us to compare the data between the two groups in order to clarify barriers to care and potentially expand reach. Data collection for the evaluation will include the test forms from the Florida Department of Health, filled out by student participants, notes and logs kept by program staff indicating offered or reviewed safe sex health practices, data from results, a post-session evaluation, and a voluntary and incentivized survey to be provided to a sample group of non-participating UF student body. Quantitative data will be collected through the pre-test Florida DOH form and the test results themselves, while the qualitative data is collected through the staff notes and logs and the post-session evaluation form. The voluntary incentivized survey should be aimed at both quantitative and qualitative measures. The data for the HIV testing is collected by staff members of Gatorwell. There are specific requirements that staff members of Gatorwell must obtain that ensure confidentiality, such as up-to-date HIPAA and FERPA training. This is of the utmost importance because the tester must feel like their information is secure and cannot be accessed by unauthorized personnel. Once the tester makes the appointment, they will first complete a pre-test that is part of the HIV testing form. All questions the tester is not required to answer, but is strongly encouraged to do so to provide proper education and assess potentially risky behavior. Standard information about the tester is also collected. Once filled out, the HIV oral swab test is administered, and the tester is told that the results will be available in approximately 2 weeks. Gatorwell currently has an HIV testing post-appointment evaluation that they have their testers complete after the session. This information and evaluation gathers qualitative data that gives insight on the tester's satisfaction with the testing process that they just went through. Some examples of data that can be collected through the evaluation include satisfaction with an HIV testing appointment, the likelihood of recommending the program to other UF students, whether the tester will talk to their partners about the importance of getting tested or the importance of using a condom or other barrier method, whether they will take steps towards getting PrEP, and whether they will return to be retested in the future. The collected oral swabs are sent to the Alachua County Health Department to be tested. The validity of the HIV test via oral swab is high. Oral HIV tests are up to 99% accurate in detecting antibodies. The data of the results will be securely stored at Gatorwell as well as the ACHD. Only certified personnel will have access to this data. Our evaluation plan is feasible based on the information provided by stakeholders. Data from prior evaluation efforts can be used as a foundation for expanding the types of data that will be collected moving forward. Pre- and post-counseling sessions that are already in place and integrating updated evaluation surveys during these sessions would be manageable. The barrier to evaluation efforts outside of Gatorwell would be having students interested. Due to the unrestricted budget, incentives can be offered to students as an enticement to get them to engage in voluntary evaluation efforts. The barriers to survey participation for the control group may be whether the incentive is appealing, whether the invitation to participate will be communicated effectively, and whether it reaches the intended population. Some possible limitations to successful data analysis and interpretation include the possibility of students participating in the surveys just to get the incentive. This can cause some of the data to not be accurate, and since there is no way of knowing their answers are truthful, this can cause some discrepancies in the interpretation of the data. A specific role will be created to conduct the data management and analysis. This team member will be assigned by and supervised by the director and associate director of Gatorwell. The appointee will need to be familiar with the HIV testing process, the components of the pre- and post-test questionnaires, and have experience in data collection. The data from the control group survey will be analyzed using both quantitative and qualitative analysis, as the evaluation is focused on what the barriers are to students not utilizing services. The quantitative data could be entered into an Excel document where different types of charts can be created to display key themes or reoccurring circumstances that participants identify in the surveys and offer a visual representation of the results. The charts will only show numbers and responses, not patient information to maintain confidentiality. These Excel graphs will only show descriptive statistics such as age, sexual orientation, number of partners, and other factors. For qualitative data, such as written responses, summary with the general theme of the responses will be created to show how the frequency of similar categories of responses. This is especially effective when it comes to identifying the possible barriers students have to getting tested. The data will come from questions asked in both the post-test and control group surveys, which help us gain a better picture of their reasonings for getting tested, motivation, any concerns, also along with the descriptive data such as the number of partners, sexual orientation, and relationship status. We will know if our data is meaningful if the responses clearly articulate and provide insight into the obstacles this program has faced. It will ideally provide insight on what needs to be done to improve the program and reach a larger audience. Evaluation wouldn't be complete without a way to share back the data that was collected with stakeholders. What would the purpose of evaluation be if not to make use of the information that was sourced in the process? Hence, it is essential to identify how the data will be compiled and distributed. In our case, the final evaluation report would ideally be created as a collaboration between the data analyst and the evaluation team. Using the visual representations of the data as created by the analysts, We would collect the qualitative themes and pertinent findings and then present them to the stakeholders. Gatorwell staff and anyone in a role to make programming decisions would be invited to review the report and presentation. This information could then be used to inform marketing and programming choices in the future. Marketing is a powerful tool to inform the student body about services, the effectiveness of services, and encourage student participation. Follow-up would occur in the form of future review of post-survey questions as needed, collecting feedback from staff as changes are implemented, and with further evaluation scheduled for the future.